Hello, I'm Bonnie Urbay. Welcome to the Contrary, a discussion of news and social trends from diverse perspectives. Up first, repealing Obamacare.
The battle over the Affordable Care Act, or Obamacare, is underway. Exactly how it will impact women's health care remains a big question. Many women are not waiting for an answer. Planned Parenthood reports clinics nationwide saw a 900% increase in requests for appointments to obtain birth control immediately following the election. That's leveled out, but still remains hot, especially for the more costly long-acting contraception such as IUD. The ACA mandates coverage of birth control with no out-of-pocket costs, as well as preventive health care coverage including cancer screenings, pap tests, and mammograms. The Republican Congress, in its first week back in session since the elections, began efforts to repeal Obamacare. Lawmakers received 2 high-level visitors. While Republicans met with Vice President-elect Mike Pence, President Obama strategized with Democrats. He urged them not to, quote, rescue Republicans from Trump care. And late this week, House Speaker Paul Ryan announced a fast-track plan to repeal Obamacare's health care reforms. That will include stripping Planned Parenthood of hundreds of millions of dollars in federal funding. Planned Parenthood would lose access to Medicaid reimbursement and federal family planning funds.
So, Congresswoman Norton, how will women's health care be affected by repealing Obamacare?
Bonnie, beginning with the bar on charging women more for health care than men, women have the most to lose by the repeal of Obamacare.
Women need to stay vigilant, and I'm sure people around this table will help inform them and make their voices heard, because there should be no reason, and I certainly will be one of the ones trying to ensure that women's health care is not adversely impacted.
Republicans are initiating a public health emergency, and it's poor women, women of color, single moms, and their families who have the biggest targets on their backs.
This was to be expected under a Republican unified government. Planned Parenthood has been a target for quite some time. This is going to be about access versus coverage more than anything.
But this week, I think it was the Kaiser Foundation released, correct me if I'm wrong, but released a report that they did some focus groups in Rust Belt states that Trump won, and the people who supported him wanted Obamacare to change. They wanted their premiums to come down. They wanted their deductibles to come down. But they didn't think that they were going to lose their benefits. So what happens to Trump if the Republicans in Congress get their way and it's totally repealed?
So there's A to B. I think what we have to talk about is that repeal comes first and replace is going to come later. I think there's a lot of anxiety about what that period means and what that looks like, but this is not something that's going to happen on day one. So 2 weeks from now, millions of Americans aren't going to lose their health care and access to their health care. There is going to be a glide path, and Republicans are creating that over the next couple of years to ensure that. So this is not something that happens immediately,
but
and there's no guarantee that it happens.
What about reconciliation and eliminating $450 million for Planned Parenthood every year, much of which goes to cover pap smears, cancer screenings, etc.?
Well, my point was about access versus coverage, and I think what you're finding is that women will still have access to health care, maybe not through Planned Parenthood and the choices that they make with respect to Medicaid reimbursement that they would no longer receive as part of the reconciliation package, but community health centers, federally qualified health clinics will still be able to provide services to women who need access to health care.
Watch out for those words, because you can hear them over and over again, access versus coverage. You know what that means? It means that
if you're poor and you have to pay, forget it.
It means no more subsidies. It means we'll do it with tax credits. We'll do it the old-fashioned Republican way. They had 8 years if they wanted to try out, and that's what they should have done. Because this is hard, try out various things. Put things on the table. Then see what kind of reaction you get. Zilch. Nothing. They don't know how to do it. They cannot do it successfully. We are implicating 1/6 of the American economy, not just those on the Affordable Health Care Act, but the Affordable Health Care Act affects seniors, it affects women, it affects people who are on their own health care through their employers.
Well, what are Trump supporters, you're an advisor to the campaign and to the transition, what about those 20 million people who got onto health care because of Obamacare? many of whom were Trump supporters. What's going to happen when they get there, and how much are they going to like Trump when their health insurance is yanked?
It was not a net of 20 million, but I would tell them, calm down, do not believe all of the hype that's out there. In fact, what they're going to do is delay the repeal or delay certain phasing out until they have something to put in its place.
But can they? Because if it's becoming such a tangled web when you learn more about what Obamacare is and how it has facets and strains and, tendrils through the whole economy. You can't just take this and keep that.
When you dicker with 18% of our economy, yes, it's a very tough thing. And we also know that the major cost drivers were never addressed, and those are the things they're going to go after. The Republican Study Committee already has a firm plan in place. You can look at that as a starting point of what the Republican plan will look like. That's not where it's going to end up. It'll be expanded and contracted from there, and they will be putting things on the table to try out.
This is just an absolute mess. I mean, the only clarity that we have here is that, you know, if you like your doctor and your doctor so happens to be at Planned Parenthood, you're not allowed to go there anymore. But after that, we don't know anything about what the next plan is for health care. All we know is that we have 20 million people on the line, 11 million of whom are low-income people who got access through Medicaid expansion that they never would have had health care otherwise. So this is an abomination, what is happening right now. And the fact that the timeline is being delayed shows that people are well aware, the Republicans who are doing this are well aware that the chaos is coming, people are going to get hurt. They just don't want to have to pay for the electoral consequences of what they're about to inflict on people all over.
First of all, nothing's actually happened yet, and I hear your point, but nothing's actually happened yet, and I agree with the Congresswoman that there's a lot of risk factors that are involved in this, and Republicans haven't had solutions. I wholly appreciate the fact that we haven't had solutions. We're 4 days into a new Congress. We're 10 days away, 15 days away from a new president being inaugurated, and I think we're going to see how this plays out, and it may not play out in the way that people are talking about at this very moment.
Okay, so when's reconciliation going to happen? Because as soon as it does happen, and Paul Ryan wants it to happen quickly, there goes funding for Planned Parenthood.
That's the one thing that has started.
Right.
The reconciliation
That is the only
package.
thing we can all agree on.
And look, I can't stress this enough. Republicans have no experience on structural changes in the economy. You look at the great structural changes in the American economy, all of which are embraced by the American people: Social Security, Medicaid, Medicare, higher education, elementary. All of them were the results of Republican Congresses, have a lot of experience. Nobody, Republicans or Democrats, have any experience taking away a benefit from Americans and then replacing it with something they not only like, but like better.
And we're taking money away from Planned Parenthood.
They won't do it.
Yeah, exactly.
They cannot. This cannot be done. They will not be able to replace it with something that will satisfy the people who are on Obamacare now, and the millions who are affected by what Obamacare did for them, including seniors.
And I have a question for you that Eleanor and I talked about in the green room earlier. What about, and I think you and I did as well, what about the fact that the Republicans are completely divided over how to do this? They all have different plans. Some want to start right away. Some want to put it off for 2 or 4 years, thereby not getting spanked by the voting public in the off-year elections or in the next presidential election.
Well, to say that they have no idea what to do would be an overstatement, because we do know, again, that the major cost drivers, that is the lack of competition, not addressing tort reform and other things and the paperwork nightmare that drive up costs, those are things Republicans see clearly have to happen, and they're pretty unified on that. Other fine-tuning around that are where it's more around the edges that there are major disagreements. And again, I guess I just have more confidence that Republicans taking a more business-like approach to this are going to clean up what is a mess. To say that ACA worked would be a total lie. I mean, we're talking about just from a personal standpoint. I had to switch my plan every year because Obamacare kept blowing up what I had, and I had to jump through hoops to try to get back towards my doctor. The promise of Obamacare was a lie. You couldn't keep your plan, couldn't keep your doctor if you liked it. The subsidies are out of control. So there's a big mess that has to be cleaned up, and I'm confident the Republicans will do it.
Do you think it'll be as big a mess if Republicans end up kicking off some 20 million people off of health care?
They're not going to be kicked off. It may be that some of them will be picked up by an expansion of Medicare once it's cleaned up.
But let me finish. Some Republicans are talking about health savings account. If you make $19,000 a year and you put away 5% of that, and you get cancer, you don't have enough money to pay for your health care. Your health care is gone.
Right, and HSAs won't work for that part of the population, perhaps. They'll probably be picked up under an expansion of Medicare once it's been cleaned up, because that is, you talk about an entitlement out of control. The waste and fraud are outrageous. We could fund more for poor people if we can clean up the waste and fraud, and they're looking at that right now.
Let's get out of the land of wild speculation and talk about what we know is going to happen, which is this attempt to defund Planned Parenthood. The fact is that there is not infrastructure on the ground in place to reabsorb the clientele that is being served by Planned Parenthood. I heard them mention before of all the community health centers. I mean, the issue is my former colleagues at Rewire did a long investigative research report on this, and basically a number of these health centers that are being touted are in fact, school nurses in elementary schools, dentist's office. Is that where you're going to go and get your pap smear? Is that where you're going to go and get your STI testing? Is that where you're going to get your birth control? No.
I want to talk a bit before we end the segment about what can Democrats do to fight this? What tools do they have? They don't control the House, they don't control the Senate. Yeah. And the Senate, Mitch McConnell is using all kinds of, the majority leader, all kinds of rules to, for example, make the vote on a cabinet secretary the same day as Democrats are in committee voting on a day-long series of votes where they can't even get away to make the vote.
Yeah, doing this by reconciliation does mean that the Republicans will own it, will do it, and will own it. And what Democrats are doing right now is to make sure that the ownership is established. How will we do this? We will do this not because we're able to defeat them during reconciliation, but because
reconciliation being when the House and Senate get together and they're different and make
vote on the time. Vote on the time when she says that the problems are around the edges. Look, in the House where I serve, people are talking 1 year, 2 years, 3 years, and 4 years. Is that around the edges? They can't even agree on the simplest part of this, which is how long the delay should be. So I just think that what you're going to see is what we do have is you got to give us equal time on the floor in the House and the Senate. And we're going to set the American people up to know what is happening, who did it to them, that we were prepared to make major changes if necessary to deal with the problems they had in the Affordable Health Care Act, and they wouldn't play with us.
Jen.
Final comment. I think from my perspective, yes, reconciliation is happening and it's going to happen quickly, and Republicans are controlling the House and the Senate. I think you're going to see this president and you're going to see this Senate play an active role in being more deliberate about how we look to replace Obamacare. And you may even see us make changes rather than go down a full replacement path.
And more inclusive. We won't lock them out of the room like the Democrats did to the Republicans.
Was President Obama right to tell Democrats, let them do it, they're gonna hurt themselves badly?
I think let us own it. I'm willing to take ownership and let us make the changes we know need to happen.
Briefly.
You know what? This is a terrible time for our country, and let's just focus on the people who are going to be impacted. And the fact is, this is a terrifying time for people. What's going to happen to their health care? They need to know.
All right. Let us know what you think. Please follow me on Twitter @BonnieRBay. Behind the headlines, we are spending more time than ever online, women more so than men. How is it affecting us? We spoke with an expert who says one of the ways is that we have become tolerant of insults and abuse to the point even where our next president engages in it.
Specifically, let's say Trump. The point is we've become so used to this horrible content online that it's become normalized, where people say, that's okay. So there wasn't an outcry when he started calling people names or being very critical of women, because that's what happens on the internet.
As a cyber psychologist, Mary Aiken studies and provides insights into the interactions between people and technology. She wrote The Cyber Effect to educate people about the risks of increased internet use and how best to manage them. Besides cyberbullying, Aiken flags online dating as another area of concern.
The problem with the online dating process is there is a perception of connectedness. When we're given pieces of information, we can tend to fill in the blanks or the missing pieces with idealized or aspirational content. Our senses have been honed and evolved over 200,000 years to actually to be very good at doing this, reading face cues, looking at body, posture, tone, language, all of that. That's all missing in online environments.
Online Dating Magazine claims there are more than 2,500 dating websites on the internet, allowing lots of users to find partners. But there is a downside.
The National Crime Agency, which is a police authority in the UK, released a report to say that there had been a 6-fold increase in sexual assault associated with online dating. 71% of these serious sexual assaults took place on the first date and either in the victim's home or the offender's home. There's a possibility that sex offenders are migrating online where they can get easy access to a wide spectrum of victims that they can select, that they can groom online. But there's something else we have to think about as well, is how does somebody end up in this situation? So in psychology we talk about stranger on the train syndrome. It's very easy to bare your soul to a complete stranger. In this very lean medium of just exchanging maybe text-based communication or chat, you may feel that you really, really know this person. But in fact, by the time you have your first date, they are still a stranger.
Aiken also says the internet gives us easier access to illegal materials such as pornography and legal but extreme content. What happens if children are exposed to it?
These kids, they are going to be the adults of the future. They are going to be our society going forward. And if we have allowed them to be exposed to everything that they shouldn't be exposed to as children, then we are responsible.
There is even the dark net or dark web, part of the internet that is intentionally hidden. While it's normally scrambled, all internet users could potentially access the dark web.
This is where child pornography is traded, or child abuse material. This is where you can get assassins for hire, Silk Road, and drugs are traded. So it's one thing for law enforcement to have to deal with these entities in terms of dealing with adult criminal population, but increasingly we're seeing kids going into the deep web.
Aiken says her mission is not to be alarmist, but to raise valid concerns.
There's an army of marketeers out here telling us it's all good. I'm introducing balance in the debate by saying, here's all the problems, and maybe we can meet somewhere in the center.
So Anne, because she was talking about Twitter and President-elect Trump and all the tweeting that he has done that he did before the election and since the election, and kids have access to that online, what impact on these children?
Well, I think the impact on children from Donald's tweets are different than some of the stuff she was talking about, the dark web and all the insults. Right. That all preceded Trump coming onto the scene. And I think over time, we hope he's inspired to show a change in how he's approached this that'll help set a tone for everybody else. But she does represent a real problem, and that's a cultural problem we have. We're insulting women and demeaning women again, and demeaning men is something that's become accepted, because when you're on the internet, it's like you're in your room by yourself and you forget how many millions of people you're impacting. I've had people, I have this one gentleman who's very bright, and he gets on there and he screams and rants and uses foul language and nobody listens to him. So I actually did an experiment with him. I said, try putting forward your ideas without doing that, because he said, nobody ever listens to me. As soon as he did, people were like, oh, that's brilliant, oh, that's great. So I think it's a matter also of education to say to these children, you know, if you really want to communicate and have it be accepted what you're saying, you have to find a way to do it. And that starts at the home, but also in schools, educating them how to better use the web.
But go ahead.
There's nothing comparable to the bully pulpit. If you have a president who leads with incivility, what in the world can you expect out in the general populace? This began with cable news, with the yelling and screaming at one another. Then came the internet, where you can do it and nobody even knows you. And now the dark internet, which is truly frightening. So how do we conquer this when there's so much media all around us? Well, there's one king in our society. It's the president. We're gonna all over the next few years appreciate Barack Obama more and more. The notion of having someone so worthy of leadership, setting example for everybody, is going to redound to our benefit time and again, and we're going to wish for that kind of leadership. And maybe if we wish hard enough, we'll get that kind of leadership once again.
How do you tell parents how they should deal with their young children online?
Sure, I think it's hard. I think that's one of the things that I think about when I look at sort of the access to the internet and the ease of use and the sort of invisible hand that is individual people, like with anonymity, being able to shout vitriol and terrible things to people. I think one of the bigger concerns I have is about how do you find a way to protect folks. I think parents struggle with this. I'm not a parent, but I understand from my friends who are parents that they face this every day. They can't police their own children. You can't have that in the schools. The teachers don't have the authority to take someone's phone and use it against them, or to say you're on Facebook or you posted a video about someone. So I think there definitely needs to be a public conversation about the types of standards that we could potentially put in place. Every state has sort of bullying laws, but what can we do to make sure that we're protecting young women but also young children?
But you think about that Chicago incident this week where the 4 people beat up and cut and injured
Kidnapped,
and berated.
beat up and cut.
And then posted it live on Facebook. I mean, how did they come up with this crazy stuff? And then on top of that, how do we stop others from doing it?
It is a culture problem. I mean, this is not just, it's in our music still, it's still in our movies. You know, they say movies are aimed at young boys, and you still have much too much violence, much too much denigration, games everywhere. And this really has to be, society has to decide that they want to go in a different direction. It isn't just the bully pulpit. Certainly the president, and if Melania does make this her cause, that will help. But it really goes beyond that. Hollywood's got to be on board too, and that may mean they suffer a little bit in profits.
Yeah, but I don't mean to be discourteous, but how could Melania Trump being married to Donald Trump possibly be taken seriously?
Oh, I think
as a figure in fighting cyberbullying.
I think she can, and I think that she will continue to have impact to get him off of Twitter or to get him to message a little differently. I think it's important that she's out there with her saying that. It will have impact on the entire government. So I think she has to at least try.
I appreciate what she's trying to do, but you know, it's going to get people saying, "Physician, heal thyself, heal thy husband first, before you try to heal the country." So I think it's very risky. I think it's very risky for her to take on something like this when her husband has been the chief problem.
I think you do both.
I'd like to come in as a parent of a young child. And the morning after the election, I just looked at my 3-year-old daughter, and I held her, and I cried because I did not know at the time how to look at her when someone is now assuming leadership of the country, who has bragged about sexually assaulting women, who since the election has gone after local union bosses, ordinary guys, and is setting this tone and example. Look, there's a huge problem with the internet and bullying culture online in general. But the fact is, we're having this example set at the top. It's very somber, it's very serious, and I hope that those of you who do have access to the inside will do what you can to change this dynamic.
And we will, but will the media and will the liberal pundits stop bringing it up again and again and again? These children that were scared by Trump, it wasn't because of what he said once, it was because you guys put it up in ads, and you bought 70% of the ads, and you put it out there again and again and again. You don't want the conversation to change. You want to continue to use it on.
So let him keep
if you
doing
shut up and we move on and move forward, it will change.
The problem is not the source. The problem is that the problem is that the source gets repeated. Come on, let's go to the source first.
That's a big part
of it. All right, that's it
for
this edition. Please follow me on Twitter and visit our website, pbs.org/to the contrary. And whether you agree or think to the contrary, see you next week.